It is an understatement to say for many people, COVID-19 is a difficult sickness to kick. Of course, we know many get very sick, hospitalized on ventilators. Some don't make it, and some that do end up having long COVID, dealing with physical symptoms for months, sometimes years after. But one thing we have not heard much about is the mental anguish some COVID survivors go through. We've invited Scott Branham, CEO of Deaconess Crosspoint, to talk a little bit about what he is seeing now. Scott, thank you so much for joining us today. I have heard accounts from people who've come down with a serious case of COVID, was hospitalized, but recovered eventually, going home. However, their demeanor completely changed after COVID, from being a happy, content person to a withdrawn, almost troubled soul. And I've heard they eventually took their own life. Now, this really surprised me. I haven't heard much about this. Is this a real side effect of COVID?
It seems to be a real thing. There's not a lot of research on a direct correlation between the virus and mental health, but we know with other health conditions, such as a cardiac event, a heart attack, that oftentimes people experience depression immediate following such an event. And COVID seems to be very much in that same vein.
Now, is this something that you've actually seen here in the tri-state?
We have seen an increase in our patients, those that have recovered from COVID, because COVID for a lot of folks is a life-changing event. We know that the disease itself can cause fatigue, it can cause some lack of concentration, and at times confusion. People describe it as being in a fog. But what we also see is those symptoms of depression, withdrawn, sometimes a reflection on just their own mortality after surviving a severe bout of COVID.
It almost sounds like they're not themselves. They don't feel like themselves at all, and it's hard to get used to that. Can this be treated?
It can be. It does fall in the same category as a depressive disorder, which can be treated by, the first approach is usually some type of talk therapy, working with a psychologist, a social worker, mental health counselor. And in more severe cases, then there are medications for antidepressants that can be prescribed that will alleviate these symptoms.
Now, what should families do? Are there symptoms that they should look out for? And do we need to talk about this more? What can we do about this?
I think we really do need to talk about it. Unfortunately, at times, any COVID conversation can take a political turn, which is unfortunate, because the symptoms of the disease are real, and they have a lasting effect on individuals' mental health. But some of the things that we really need to look for are changes in appetite, changes in sleep patterns, withdrawal, and a lack of interest in daily activity. Those are the beginning of symptoms that there could be a underlying mental health or depression disorder.
And so if you do notice that in perhaps a family member that has gone through COVID, what do I do?
Well, the first thing that I would recommend doing is to reach out to seek help. If individuals don't know where to begin, their primary care physician is a great place to start. There are other providers in the community, mental health providers, whether that be at Deaconess Crosspoint, the Mental Health Center, or other mental health providers in the community are available to assess, diagnose, and treat those symptoms.
Now, is this something, COVID's pretty new, so perhaps you know the answer to this, but is this something that a person can overcome? How long does it last?
Usually, depressive disorders last anywhere between 3 or 6 months. For other individuals, they may be longer lasting than that, but usually, typically 3 to 6 months to overcome a depressive episode.
But there is light at the end of the tunnel. It sounds like it can be at least treated and overcome eventually.
Absolutely,
Okay.
with some counseling, and as I mentioned before, at times medication. It is a disorder that can be treated, managed, and overcome.
And absolutely, this is something that we definitely want people to know about if they experience this at all, to reach out, get help. Scott Branham, CEO of Deaconess Crosspoint, thank you so much for talking about this important topic of conversation here with COVID in our community. Thank you so much.
Thank you.
And if you are having thoughts of suicide or depression, you are not alone. Call the Suicide Prevention Hotline, the Lifeline, at 1-800-273-8255, or reach out to the suicidepreventionlifeline.org.